everyone. I'm Dr. Mugdha Raut.
I'm Dr. Mohan Raut.
Welcome to the next episode of the LIT Show. The LIT Show is a show organized by Dr. Raut's Center for Reproductive Immunology. Dr. Raut's Center for Reproductive Immunology is a highly specialized center which treats couples with unexplained recurrent miscarriages, unexplained IVF failures, and unexplained infertility with the help of lymphocyte immunization therapy and other passive reproductive immunomodulatory treatments. The purpose of this show is to invite various gynecologists, IVF specialists, not only from India, but all over the world, who have been using lymphocyte immunization therapy for their patients. And even we interview patients who have benefited from this therapy. We have now 3 centers doing reproductive immunology. We have 2 in India, one in Santa Cruz, Mumbai, and one in Nagpur, and another international center in Kuwait. Today we have a very esteemed doctor from Brazil. Over to Dr. Mohan Raut for the introduction.
It is indeed our pleasure today to have a great clinician and expert in the field of not only gynec obstetrics, but also in reproductive immunology from Campinas, Brazil, near Sao Paulo. And that is Dr. Ricardo Barini. Welcome, Dr. Ricardo Barini, to LIT Show.
Yes, good afternoon to everybody. Thank you very much for the invitation. I'm very happy to participate in the LIT show.
Thank you, Dr. Ricardo Barini. I would like to introduce Dr. Barini. He has a long CV, a lot of research work, a lot of papers. To sum up, I will have it in a brief way. Dr. Ricardo Barini is MD, PhD. He is a full professor of obstetrics and gynecology in the University of Campinas, Sao Paulo, Brazil. He has done his graduation in December 1979. His doctoral degree in 1989. His postdoctoral training was in Rosalind Franklin Medical School, the Chicago Medical School, between 1991 and 1992. And his full professor degree he got in 2014. And recently in 2021, he was honored for his work in the field of reproductive immunology by American Society of Reproductive Immunology with the Fellowship in Clinical Reproductive Immunology. He has held many positions so far. He was the head of fetal medicine in the Department of Obstetrics and Gynecology, UNICAM, between 1993 and 2016. He was a professor at Recurrent Abortion and Fetal Loss Clinics between 1993 and 2016. And he has his own clinic, Dr. Ricardo Barini's clinic, of which he is director from 1982 till date. He has done a lot of work in the field of infertility and in reproductive immunology. And we are happy to say or share with you all that he has done pioneering work in the field of lymphocyte immunization therapy, and his work in the recent years has contributed immensely to the recent evidence in the field of reproductive immunology. The new recent meta-analysis, new research papers have contributed a lot to the efficacy of lymphocyte immunization therapy, and we will be hearing about this from him in this show later on. So I think welcome again, Dr. Barini, and we will start with our LIT show. So to begin with, sir, we are quite interested to know how you entered in the field of medicine. Can you elaborate? We're going to the beginning of your career, maybe. So,
well, I think I was a quite active little boy, and I have been so many times to the emergency room getting stitches and bruises that I got interested in how this works. How does it put stitches in a person? How does it do anesthesia, and I was very interested. I had an uncle who was a neurosurgeon and also a professor at the medical school in Sao Paulo, and he was kind of a hero for me. And so I became very interested in medicine very early. And later on, when I reached my adolescent years, I got involved with a lot of music, and that's my hobby right now. I used to have rock bands and play guitar and things like it. And then I went to live in the US as an exchange student when I was 17. And that's when I learned a little bit more of the English language. And also I did my last year in high school there. And then when I came back, I had to decide which field I would go into the university. And after struggling a little bit between what I would like to do, I finally went up to medical school. And during the medical years of training, I had to wonder what am I going to choose as a doctor, And as I told you, I entered medical school thinking about being a neurosurgeon. And I knew everything about neuroanatomy. I was, a straight A student in anatomy and physiology and things like it. And then I realized that neurosurgery would be a very hard life for me, dealing with, accidents and stuff like that. And I said, oh, I don't think that's the right thing for me. I started getting very much interested in psychology and psychiatrist, and I did a lot of learning of that. I did some training on it, but I loved surgery. I really like to do surgery. I maybe from my early childhood years, watching people put stitches on me, I said, I love that. And I finally came to study obstetrics and gynecology just by chance. I never thought of being a gynecologist or something like it. And a friend of mine invited me to be a trainee in our department. And I started, doing pap smears and research for cancer and watching people delivery. And I said, wow, this is a specialty that unites everything that I like, because it's a lot of surgery, it's a lot of clinical work, and has a lot of psychology and almost psychiatric or also, do a consultation with a woman all along the years. You have to be very keen on dealing with these matters too, not only being a scientist, or you have to be keen on the human relationships and understanding how to deal with the problems, that women faces during her life. And that's how I became a gynecologist. And after I did my training as a residence training, I got promoted to be a professor, in the beginning of the career as a professor at the medical school, until I finished my doctoral, which was in 89, as you said. I finished medical school in 79, and then 10 years later, I had my doctoral degree.
So after finishing your, after 79, then did you start with your own clinical practice as an obstetrician gynecologist, or how did it happen?
Yeah, I did already. When I finished my residence training, I was working as a professor, but I already had my own private clinics. It's here in Brazil, you have the health system, which is a public health system, which is very large. And also you have the private health system, which is not so large. And so I did a little bit of private practice and I have myself as a professor. And so most of the time I was a professor, and then my clinic was not so big at the time. After I finished my degree, that's when I had a chance to get involved with immunology. So we can talk a little bit about that a little later, or you want me to talk about it now?
No, so then in your practice, was it the infertility part that attracted you? How was it then?
No, at first I was really interested in infertility, but in our department, infertility was not very hard, not very keen, and the doctors were not very, involved in infertility at the time. And it was the beginning of the infertility clinics, and there were not many doctors willing to work on it, and the ones that were working it were not very happy to share what they knew about it. They kind of hide it for themselves, and so it was a kind of a hidden area in the department. You never knew what was going on there, and so I was not very involved in that. I became involved with the immunology because a friend of ours from the university was doing a research looking for anti-HLA antibodies in multiparous women. And she was looking for to mark the percentage of women that would have anti-HLA antibodies in their blood. And the way we did it is we collected blood from the cord blood and checked with the serum from the woman and see if the serum would recognize some HLA regions from the baby's cells, meaning that she would have recognition from her husband's HLA, and that's how I started getting involved in immunology and all this kind of thing.
So that's how the
So how did you start with IVF?
Well, that was very long afterwards. Before that, I did my doctoral thesis in the field of obstetrics only, and then when I had a chance to meet Dr. Alan Beer.
So I think we would like to hear that in detail from you. How you started your reproductive immunology, how you developed that interest, and how did it start?
Yeah, that's how we got involved with that. Dr. Beer, I started knowing about his work doing this research with HLA antibodies in these women. In multiparous women, and I was presenting this short paper in the FIGO meeting that happened in Rio. I think that was 1988 or around 88, I think, 88 or 89. It was just before I did my doctoral thesis, and Dr. Beer was at the meeting, and he was presenting his first results in LIT, showing how it worked and the idea of immunizing women for recurrent abortion, how he idealized the treatment and how did it all start. And I watched him speaking, and I said, wow, that's a new field. I gotta get into it. I gotta get involved in it. And then just after he finished his talk, I went up to him and said, oh, I'm Dr. Barini. I am professor at the medical school, and I would like to spend some time with you. Do you offer any training programs? And he says, yes, you can come up and stay with me for 3 months or 6 months. And I said, yeah, I have to finish my doctoral thesis first, and then I'll be able to get a leave from the medical school to get to know it a little bit better. So I finished my doctoral thesis, and I started applying for a grant to be able to go to the US. And I finally got it only on 91. So it was quite some years of letters going up and down. At that time, there were faxes, Remember fax? Right. I would send faxes to him, and he would answer back, oh, can I go there? And then And then after a while, I realized that I would get a grant only if I would stay for 1 full year. They wouldn't give me a grant for just half a year. And then I had to ask him, "Oh, can you accept me for a full year?" I said, "Oh, that's great. If you can come, that's fine." So we took all the family. I had my wife and 2 kids. They were 9 and 7 years old. And then we went up to Chicago and stayed there at the clinics with Rosalind Franklin and medical school and watching Dr. Beer work and working at the lab with Dr. Beeman. Dr. Alice Sachs was the head of the lab also at the time. And Joanne Quack also there. I keep teasing her because she was already there when I got there. Although I am a little bit older than her, I said, "Oh, she was my boss." But she didn't accept that. So I had a very great time. And it took me the first months to learn about immunology because, as a medical student, you learn about immunology, but deep immunology is something else. And then I think it took me about 3 months to understand what they were talking about, what's going on here, how this LIT thing works, where does it come from. And then I learned that Dr. Beer had a full almost 10 years of research in animal research before even thinking about applying it to humans. So he and another great immunology expert, Billingham, with him he worked. So they put together, I don't know how many papers they had at a time, talking about how immunization of a certain kind of rats would combination with the other rats, and then how would they figure out how immunization would work for them. So many papers that I read from that time. And then to the first person that received an immunization that I got to know them, the boy was born from this experiment. And he was, when I was at the medical school, there was a meeting which was called the Baby Beers Reunion. And it was the baby, it was a fun thing because he would say the baby beers, but it was a bear. So each kid would have a little bear with them and saying, "I'm a beer baby,
Beer baby,
bear baby, but a beer baby." And then this boy was already there. He was about his 18 years old, I think. And then he went to medical school. He became a doctor. So the first boy born of LIT became a doctor himself. It's an interesting story. So after spending this year with Dr. Beer, I came back to Brazil. And then, as I said, I started setting up the treatment in the medical school, which is a public school. So it's a free of charge treatment. And luckily, I convinced directors, and I convinced at that time people from the hematology department and chemotherapy. So they would be the ones that would prepare the immunizations for us. So for maybe 4 or 5 years, maybe 6 years, I think we used the university lab to produce the immunizations. And then I started using the same lab to produce for my private clinics because there were so many patients coming and they were not eager to go to this public setting. They wanted to a private setting to be treated on. So I started having patients requiring a private treatment for themselves. And then it got to a point in 1988 that I finally realized I would need to have my own lab. And then I invited a friend of mine, Dr. Simone Batista, and we got together and set up our lab at the time. So by 1998, we already invite Dr. Beer to come to Brazil. He came to Brazil to do a Barini Beer reunion, and we have the first 100 babies that were born through LIT reunited in a room, and then it was kind of a homage to Dr. Beer and his treatment. And he was very happy to have this, seeing all these people, all our program running in the university. He was very, very happy with this. And then he gave some lectures at the time around. I took him to São Paulo too, and it was very good time to show him that his work was proliferating outside of the US. So this went on, and then I kept being part of the American Society of Reproductive Immunology. I came, to many of the meetings. I wouldn't say not all of them, but many of them I would be able to attend. And then this went on, and then I started getting involved with IVF. That's when by around 90s. Now, by the end of the 90s, I really started getting interested in working with IVF. And one of my friends that became my patient also, he set up a clinic, and then he invited me to start working at the clinics. And that's the clinic I still work today. It's called Androfert. It's a very good fertility clinics.
So, sir, before this IVF, means now so many years you were working in the field of reproductive immunology. So, what do you think about reproductive immunology and its role in reproductive failures? Do you think how important is reproductive immunology? What is your opinion? And because there are different views about reproductive immunology. So, can you?
Well, Raut, I think immunology has a very, very important point to make in recurrent pregnancy loss and also in IVF failure, because I've been working on it for 30 years right now. I came back from the US in 92, so we're 2022 right now. So it's 30 years that I've been seeing patients and working with them. And I'm pretty sure that there's a big difference in doing the treatment for this patient and how they progress on their lives with, becoming able to have families and becoming able to be mothers and parents and so on. And I'm absolutely sure that this has a point. And I cannot accept, and I stood up in this last meeting in ASHRI meeting. There was this friend of Dr. Bettina Thas was giving a speech on recurrent pregnancy loss and saying that I could feel that she likes immunology and she does immunology, but she cannot say it because ASHRI doesn't accept immunology. And the Americans do accept a little bit more. They do have even attached to the American Society of Reproduction. They do have a section on immunology and early pregnancy interest group. And I feel that the early pregnancy interest group in Europe is absolutely against anything about immunology. And then after she gave her speech, I said, Bettina, I'm sorry. I am here listening to your talk. And it seems to be I am reading a book that's 30 years old. So you said nothing new. Because the only new things it's only immunology. There's nothing has changed about the treatment of reproductive losses in the last 30 years, unless immunology. So I think, I'm sorry, but I think this is not a good point you're making here. And she said, you're right. You're right. And afterwards, she said, after the talk was finished, I came to her and said, I apologize. I didn't mean to be rude to you. She said, it's okay. And you have to do it because ASHRI doesn't accept doesn't give any funding to research on immunology. So that's the big problem. There's so much prejudice against immunology. And that was created, I think there's a big political thing about immunology and the societies. And that's what makes me mad. I saw that happen in the US. Quite well that in 1999, there was a paper published by Ober and a group of friends, and especially Scott, James Scott. And James Scott used to be a fellow together with Dr. Beer when they were working with Billingham. But I think they became quite separated after Dr. Beer produced so much more work than Scott. Oh. And if you look at the number of papers published by Beer and Billingham, and if you look at the number of papers published by Scott and Billingham, there's only one paper by them. And then in that paper, Dr. Beer is also in the paper. So that gives an idea of the productivity of Dr. Beer against Dr. James Scott. And it seems to me that James Scott did everything he could to put down Dr. Beer's idea. And then he finally got that through this paper, which is a fall paper. We all know that. The community know that, but he got it to be published at Lancet, which is, a very important paper. And that made US FDA put down a ban in immunization in the US by the end of 99, the beginning of the 20s.
Right.
And after that, Dr. Beer was very, very upset, and a lot of other doctors were upset. There were many papers written complaining about what was going on. Many papers saying that this paper was a flaw paper, and showing the problems that the paper had, and not only on the production of the paper, but the conclusions that they came to. Right. But what happened is that somehow James Scott got invited by Cochrane Library to write the guidelines. And of course, James Scott said LIT was not a good treatment and that should be banned. And that's how it started to be so prejudicially being put down all over the world. And we saw that happen in the US first. And then what happens is that many people imitate what the US does. So that culturally, the US exports the good and the bad things too. So, and we were able to do the treatment until 2016. And then in 2016, we had to stop our treatment and change the treatment to other forms of treatment other than LIT. But we're considering starting it over again and applying for it to be on again, since we have so many papers published saying that the LIT is actively working. So my hope now is, that when I was at the meeting in Tennessee, I applied for being kind of a representative of the American Society in Latin America. The influence of this paper in the whole medical community had an influence in the doctors in Brazil, and they had like our FDA system here, our FDA agency here, and they asked us to stop the treatment in 2016 because, well, there were two concerns. At the time, we had the big Zika virus spread, which was a main concern, not only in obstetrics, and so for LIT would be a problem too at the time. And there was a not only Zika virus, there was a chikungunya virus, there was dengue virus also. So the three viruses were just bursting out in our country.
Right.
And together with that, the pressure to have another randomized control trial showing that LIT would be an effective treatment made our FDA agency here, which is called Anvisa, to ask everybody to stop the treatment down in Brazil, and that's how it stopped here. So right now, my idea is trying to bring the idea of doing the treatment again, because I told you I applied to be sort of a representative of the American Society of Reproductive Immunology in South America. So I'm trying to get more doctors involved in this movement and to try to liberate LIT in Brazil again. So that's one of the objectives I have. Yes.
So what was your experience? Now you practiced actually so many years in Brazil. So what was your experience about your patients and cases in clinical experience about LIT lymphocyte therapy?
Well, my experience was excellent. I had 86% of our patients had kids at the after the first treatment. So I think was a very, very good result that we had. And we published that also, joining not only my experience, but the experience of two of my ex-students, which are now my great colleagues, Dr. Cavalcanti and Dr. Sarno. Dr. Manuel Sarno works in Salvador, Bahia, and Dr. Marcelo Cavalcanti works in Fortaleza, the two cities very far from our area. They're in the east and north area of Brazil. So we three got our numbers together, and we published more than 1,000 cases with the very, very good results. And so we're very proud of what we did, and we are sure that if we can put that together again, there are many doctors in Brazil that do like LIT, and they are willing to have patients doing the treatment with LIT. But we still have to convince the society, the Brazilian Society of Assisted Reproduction, to get more understanding of what we have as evidences today, not being based on what we had 20 years ago. Things have changed. So many publications from China. There were many papers published showing the LIT was a good treatment. I reviewed just recently a paper from Philippines. Also, it's going to be published, I think, right in the American Journal of Reproductive Immunology very soon. I think on the next number it's going to come up. So all of these numbers showing that the LIT is an effective treatment should be enough to bring the treatment back on the road again. So I'm very hopeful that this will happen soon.
Right, but still, Dr. Barini, do you feel that immunomodulation using lymphocyte immunization still has a great role to play in future?
Is it a gold standard still?
Yes, I think it is. I think it is. I think it should be the gold standard. I wish I could use it, and I'm working on it to be back and going back to use it again, because I think it's a very good treatment, and it's a little bit hard work than just using medication, which is just prescribe a medication and just give it to the patient. But I think it has a stronger response. I do feel that with LIT we were a little bit better than what we are now. So I wish we can go back to use it again.
Yeah, because we have similar experience over last so many 8, 9, 10 years where we are doing at our center. We are combining our experience, and whatever information about LIT which is there in the form of a book which I shared with you, that very soon our book also is coming. So let's hope that LIT will see again uh, good days as it was before,
Deserves, yeah.
and what it deserves. And because your work has contributed a lot, I think one question always there in my mind is about the study which you mentioned, the 1,000+ cases. I think it's a very interesting study. Can you just briefly tell about that? Because I feel it's a complete study where you have considered autoimmunity, alloimmunity, and thrombophilia together, and
Yes.
shown that. So, can you just tell about that study? Means how so that people will know more about it.
Well, that study tried to identify women with only autoimmune problems, alloimmune problems, and the association of alloimmune with thrombophilia, autoimmune with thrombophilia. So the more uh, the more we have association of things, the worse would be the result of the treatment. So the best results would be with alloimmune only, and then the combination of alloimmune and autoimmune would be a little bit worse, and then the combination of thrombophilia would bring it down a little bit more. So that's how we try to divide the diagnosis of those patients. It's very hard today to do such a study because, well, it's not very hard because we keep doing the same investigation to all patients that come to us. So if we stop now and go back and try to retrieve our data, probably going to find the same thing again, and the same numbers probably are going to be repeated all over, and the association would be still there, and the results are there. Yes, this I'm sure.
But that study also showed that the LIT group had a higher success, more than 60% compared to just 33% with the non-LIT group.
Oh yeah, sure. That was clear. You know, the results with LIT were much better than without LIT, and this has been the experience all over the world. So I don't know why that's so hard for people to accept that LIT works.
It will happen. Yeah. We are very sure. So I think before we close,
Yeah, I would like you, what would be your take home message for doctors and even for patients? Because people who will be seeing this program will also be patients who will be more interested in LIT. So, what would be your take home message to them?
Well, my take home message to doctors, especially, is that they have to be more understandable of what the woman's needs in reproductive loss. Instead of saying, keep getting pregnant with no treatment. And there is a treatment, there is a research, there is a way to do it, and just send the patients to who can do it. Now, if you don't know how to do it, don't do it. Send your patients to who can do it. Refer your patients, because there are so many doctors that know how to do it. All over the world now, we have specialists in reproductive immunology that can take care of your patients. And I think LIT will be #1 treatment all over. I think it will soon come back to be the treatment #1 to be offered. I think this is true because India, China, which are, huge populations and huge number of patients are being treated with this technique. I think this is a lesson to be learned to all the rest of the world. And I understand that this would be my very special message to the doctors. Pay attention to what your patient needs, not only to what's written in the books. And and to the patients, yeah, look for the doctors. Look for the doctors who can help you. Yeah. Instead of just waiting for answers coming from your doctor. Don't keep waiting. Yeah. Google it.
I think they clinically speaking, our experience, because we get referrals from IVF centers for LIT. So there are centers who do everything, even the PGTA is done of the embryos, and only after PGTA tested embryos fail, then they refer for LIT, and almost 100% of those patients have done well. They have succeeded with lymphocyte immunization therapy if everything else is ruled out, that even ensuring that even with euploid embryos, if the patient is miscarrying or IVF is failing, so all those patients definitely have this immunological problem and LIT works in them. So that was our experience.
There's another paper, very interesting, from a doctor from Argentina. Famboin is his name. And he showed also that the number of IVF treatments would shorten by 1/3 with the LIT. So if you do LIT, the number of transfers you would need to get a patient pregnant would be 1/3 less than the ones that are being done right now. So it's very interesting work too.
Very good. So that's great, I think.
Yeah, it's good. It's a good science.
So we would like to end this LIT show with a very big thank you to Dr. Barini for throwing light from the history of LIT to what is it today and what is the importance of LIT. I'm sure this is going to benefit a lot of patients. And as you say, even doctors, this is an eye opener even for doctors, which will make them think that you have to think beyond, I think maybe just what the, maybe a review says or something beyond that, so that we help more patients benefit from this treatment. Thank you, Dr. Barini.
Thank you so much for being on the show, and it was indeed pleasure to interact with you, Dr. Barini.
Thank you so much. I'm the one who would have to thank you for the opportunity.
Thank you.